Let's get all these phones ringing right now. Come on, everybody. Let's get all the phones ringing. Because we only have 40 minutes to go. So if you've been waiting for the last minute, wait no longer. The last minutes are upon us, and it's anything goes. We will be enormously grateful for whatever you would like to give to the IWK.
And we talk about giving, we talk about it being a gift. What a great idea to give someone else a gift. If you have someone who's celebrating a birthday this month, this is the 1st of June.
It is.
So we're here. If you have someone who's graduating, if you have, what better gift would there be to receive than knowing that
Absolutely.
Someone you loved helped make a difference
and
to maritime
families. And it's a gift that just keeps on giving and giving and giving, and you never know when you're going to be the beneficiary of this. Bill, get in here, because, you know.
You know, I was just thinking about this. The other thing about it is when some people, you know, that you get up in the morning, you read the news, and the news is so down, so dour. Tomorrow, people are going to get up and they're going to read the news, they're going to hear about this. And if they have been part of it, if you've given even a little bit, you're absolutely a magical part of this. And you can sit there and look at all the bad news and go, look at that good news, I was part of that. That's a powerful incentive.
You, by the way, were the first person I ever heard make the point, and I think it's a good one now as it was then, that when you see big checks come out and when you see all the monthly donors come out, some people think, well, what difference can I make? We don't want you to feel that way, because you'll make a big difference. What happens here in the next 38 minutes or so will probably determine, it will determine where we finish.
Well, look what Roundup was. Even Roundup was just a matter of a few cents off every dollar.
That's right.
And all of a sudden it starts to accumulate. And if you get 50 people doing $5, look what that does. I can't add that, of course, because that would be like adding, and I could forget that. I've been here since 7 this morning. So, yeah. But it's a bunch of more times 7.
You're a comedian, not a mathematician.
That's exactly right.
All right. It's time for a tote.
Tote.
And believe it or not, we're having a technical problem with our tote. It's called a tote tech foul-up. So what we're going to do is we're going to...
Is that like a costume?
Here, help me hold this up.
We have to make it dramatic. How do we make a piece of paper dramatic? Okay.
Here's our total at just after 6:05 tonight. Here it comes.
And I let go, sorry.
Zoom in on it, zoom in.
There you have it, it's
Pound zoom.
$4,26,448.31. How about it?
$4,026,448.31.
Now, we may need a power hour for a new tote board. I don't know. Because
at CTV, we believe we have a responsibility to ensure maritime children receive the very best medical care and treatment in Canada. That's what the IWK Health Centre provides, and that's why we are so passionate about presenting the IWK Telethon for Children.
Lines are open, operators are standing by. We've got a lot of our CTV colleagues right up here, ready to take phone calls, and a couple of them have free hands, right? So give them a call, 800-595-2266. This is a very quick thing to do. They'll ask you how much, how you want to pay, get your name and address, that's it, done. And again, it's whatever you can do this next 40 minutes.
Absolutely.
30 minutes.
Right now we're going to meet a couple of twins who have certainly benefited from being patients here at the IWK, Megan and Mackenzie Haylock. Now, you're about to hear about their special bond and how they are just, well, inspiring everyone who knows them. Take a look.
We have 4 children. There's Madison, that's 9, Mitchell, that's 5, and the girls, Mackenzie and Megan, that are 3. The girls were born at 39 weeks. We had them home for close to 5 months. They were gaining weight beautifully. They were both nursed. And one day I just noticed that one of the babies looked to be swollen almost. It was Megan, and she just appeared to be larger than Mackenzie, and we didn't see any urine output. So we took her into the home emerge, and they thought that we should be directed through to the IWK. So Megan was in the ICU, and we were quite concerned. So they did a biopsy and told me that she was in acute renal failure, and they were going to start dialysis. By the second week we were here, my husband and I were questioning if Mackenzie may be sick as well. And it was 3 weeks to the day that Megan had received her dialysis catheter that Mackenzie did as well.
They were on dialysis from October of their infant year, which would be around 6 months because they were born in April, and until the time of their transplant, which was in mid-July of '06.
The kidneys were not getting any better. If anything, they were getting worse. There was absolutely no function to them, and that we were going to place both girls on the transplant list. We decided to do dialysis training in hospital in hopes to get the girls home for a while we waited for transplant.
It's definitely a first. We've had many children through the 4 Atlantic provinces go home on dialysis. We've never sent 2 to 1 home.
We came into the hospital with Megan very sick one day, and she was due to go down to have her port removed. It had been infected. And just moments before I was walking out the door, a very excited Dr. Acott says, "Michelle, I have kidneys." And I didn't know what to say. I remember sitting on the floor, and he sat up in a chair in front of me. And he went through a whole lot about the age of the young gentleman that had passed away, and what a good opportunity it was for the girls.
It's a huge effort for the health center broadly, between the ORs and the ICU and nursing groups and so on. But it can be done, and we mount the challenge because getting a kidney is so life-changing for the children.
Kenzie went in first at around 9, and they came back and told me around 20 after 11 that they were going to take Megan down and access more IVs and get her ready because she didn't have a port. And 6 o'clock the next morning, Dr. Acott came in and said both girls had gone through fine. We
did check with the Canadian Organ Registry, and they definitely are the first in Canada, probably the first in North America. They're not the first double transplants done. Kidneys from deceased donors come in pairs. So we, on 2 previous occasions, transplanted 2 children, but from different families. We've done over 180 transplants here since the early 70s, and more than 80% of those children go home to communities that are an hour or more from Halifax. So we were able to secure Murray McCrossan, the family doctor here, who is, in my view, wonderful for these 2 children. He rallied his emerge department and his nursing and labs, all the things that are necessary.
Michelle has learned so much of this herself through discussions with the IWK, and then I think just also through her observation when she's been down there, that between the 2 of us we're often able to figure out ahead of time what IWK is going to suggest given a particular problem.
Knowing we've had a transplant, now we know that we're in it for the girl's life. What we hope for is that we'll get stable, that we only have to come in for routine visits, and that the year for the next transplant will be many years down the road.
It's another amazing IWK story. What's your IWK story? We know that in the past 5 minutes some people have called here and gotten a busy signal because the phones have been very busy. Right now there are phone lines available, quite a few of them right here and in the other phone centers. So 800-595-2266 gets you through right now with whatever donation you want to make. Any amount of money. It's not about monthly donation. It's not about a predetermined amount of money. It's about what is in your ability to contribute, your desire, and obviously your budget. And we have another great sponsor of this telecast in this hospital that we want to acknowledge in a meaningful way. And please take a look at this message about our friends at Emera.
Hi, my name is Elaine Johnston, Good Neighbour Charitable Committee from Emera. I'm in the IWK Emergency Department, where over 7,000 maritime children visit annually due to injuries. Child Safety Link is committed to reducing preventable injuries in children, a program supported by Emera since 1997. Since its inception, Emera has contributed over $1 million to improving children's safety. The Staff Lottery and Good Neighbor program highlight our employees' commitment to the IWK. We are very proud of this ongoing support.
You're proud of this ongoing support. We're proud of this ongoing support. That's the whole point. I'm glad, Gerald Bassini. I'm glad you're here. How are you?
I'm very well. How are you, Bill?
Every year we get up at this time, around this time, because it's one of those special moments, right?
Very special moment.
Absolutely. And what we're going to do now is I'm going to ask you one thing, though. Is there any ever reluctance from any of your employees about any of this, or from the corporate or whatever?
None whatsoever, and if you look up in the top row, you see all the orange shirts with a bunch of folks from Nova Scotia Power.
I saw they're practically incandescent up there. It's so beautiful, you know. They glow. They don't even need power. See, that's what's neat. That's all that green thing, right? Anyway, flip the thing. Let's go. Let's get over with the suspense. Ladies and gentlemen, $122,000 from our friends at Nova Scotia Power in America.